Welcome back, everyone. We are now moving into the second portion of our pre-licensing day. Nikki and Maciel will be presenting on BadgerCare Plus eligibility rules. Please put all your questions in the live Q&A, and if we have time at the end and there are some answers or some questions that can be answered, we will go ahead and do that. Nikki and Maciel, please go ahead whenever you are ready.
All right, thank you, Elizabeth. Appreciate it. Just want to make sure everyone can hear me before I start. I see some thumbs up from my help this morning. All right, thanks. Hello, everybody. Welcome back to session 2, BadgerCare Plus eligibility rules, or welcome back if you were with us for the first session this morning. Just like with our first session, questions can be answered in the Q&A box, and we'll address them at the end of the session as long as we have time. My coworker Maciel is here with me again to assist with questions, and if there are any we can't answer or don't have time for, we will be sure to get those answers to Elizabeth so she can follow up with you all later. Now, I did mention at the end of the last session that there was a single-page PDF that was sent out with your invitation or your appointment, your calendar appointment today. And I was informed that unfortunately that did not get sent out initially, but it has since been sent out to everyone, is my understanding. So we won't be looking at that until about partway through the presentation. So if you have time to either bring that up on another screen or print it quick, I would recommend doing that. I'll give you time when we get to that point in the presentation as well. I'll give you time to get that up and to get that going. So I think we are ready to go ahead and get started. All right, today's agenda includes the purpose of this training, an overview of BadgerCare Plus, including the non-financial and financial rules and resources. The purpose of this training is to provide navigators, certified application counselors or CACs, partners, agents, and brokers an overview of the eligibility rules for BadgerCare Plus. As a reminder, session 1 this morning was on applying for Wisconsin's healthcare programs, and tomorrow's 9 a.m. session will focus on eligibility rules for elderly, blind, and disabled Medicaid. First, let's take a look at an overview of BadgerCare Plus eligibility rules. Before we do, please keep in mind that this training provides an overview of the eligibility of BadgerCare Plus. It's not intended as a training on how to determine eligibility. Only income agencies can determine eligibility for most programs. The policies described in this training are subject to change, and updates are available at the links shown on. The first takes you to a page that provides links to different healthcare program information, and the second link takes you to a page where you can sign up to receive email updates regarding DHS programs and services. Before we get into the presentation, I want to mention again, as I did during the first session, that during the COVID-19 federal public health emergency, there were some temporary changes put in place for healthcare policy. We're in the process of unwinding those policies, and unwinding is the term our federal partners use to describe returning to routine Medicaid operations after the COVID-19 public health emergency, or PHE. So again, during the PHE, we maintained continuous coverage in which BadgerCare Plus and Medicaid members remain eligible unless they passed away, moved out of state, or asked to disenroll. They were not required to complete redeterminations of their eligibility during this time. We temporarily suspended premiums, mapped work requirements, and a requirement for childless adults to answer a question about treatment needs for substance abuse. Our current status of unwinding is that new applicants who apply for BadgerCare Plus or Medicaid on or after April 1st, 2023 do not have continuous coverage. But for existing members who enrolled prior to April 1st, 2023, we must maintain continuous coverage for them until a full redetermination of eligibility, which in most cases will occur at their next renewal. Renewals for those existing members for whom we must maintain continuous coverage or distributed evenly over a 12-month period from June 2023 through May 2024. Premiums and MAP work requirements will be reinstated starting January 1st, 2024. The information in the provided in the training today does not include the temporary rules, but you might hear me mention them during the presentation. So again, just wanted to remind you of them, make you aware of them, and where we're at in the unwinding process. I do want to make sure I see something in the chat about someone that did not receive the PDF, and I just want to make sure that that's been seen and that we're getting the information out to them. All right, BadgerCare Plus covers children ages 0 through 18, parents and caretaker relatives of children ages 0 through 18, pregnant people, and childless adults ages 19 through 64 who are not receiving Medicare except Medicare Part B immunosuppressive drug benefit, which is called Part BID. All right. I'm going to pause because it looks like we've got a lot of people saying they haven't received the PDF.
I believe they're working on it.
Okay.
How many more slides before you hit the PDF, Nikki?
I don't remember for sure.
Well, what we'll do is we'll hold up once we hit there if we haven't received the link yet. So
sounds good.
We're going to continue, hon.
Okay. Yep. So for anyone that didn't receive the PDF yet, you don't have to continue to comment. They're working on getting it out. And we will pause when we get to that point in the presentation to make sure that everyone's received it. So thank you all for letting us know that you had not received it yet. BadgerCare Plus is a state and federal program that provides healthcare coverage for low-income Wisconsin residents. BadgerCare Plus is funded by Medicaid Title 19 and the Children's Health Insurance Program, or CHIP, or Title 21. Most of the BadgerCare Plus populations are funded by Medicaid, but some higher income children and the prenatal program are funded by CHIP. Is primarily a program covering low-income children's healthcare needs. CHIP also covers pregnant women who are enrolled in the BadgerCare Plus prenatal program. Let's take a look at the non-financial rules for BadgerCare Plus. Individuals must fall into one of these groups to qualify for BadgerCare Plus. A child aged 0 through 18 years old, a parent or caretaker relative who lives with and cares for a child aged 0 through 18 years old, and there's no age limit for the parent or caretaker relative that's caring for the child. A pregnant person, again, there is no age limit, or a childless adult aged 19 through 64 years who is not receiving Medicare except Medicare Part BID. Now, a childless adult is a person aged 19 to 64 years old, not receiving Medicare except Medicare Part BID, and who does not have any dependent children younger than 19 years old who reside with them at least 40% of the time. And marital status has no effect on a person being a childless adult. As I mentioned earlier, the healthcare benefits for some children with higher household incomes are funded through the Children's Health Insurance Program, also known as CHIP. This includes children ages 1 to 5 with income above 191% of the federal poverty level, or FPL, and ages 6 to 18 with income above 156% of the FPL. As a result, these children are subject to different rules regarding backdated coverage and crowd-out policies. Additionally, to qualify for BadgerCare Plus, individuals must be a Wisconsin resident physically present with an intent to reside in Wisconsin, be a U.S. citizen or qualifying immigrant, provide their Social Security number with some exceptions, and supply required information and verification within the required time frame. Finally, they must pay premiums if they are required and meet crowd out rules when they apply. So children with higher incomes may not qualify if they have access to or coverage through certain employer sponsored health insurance. And some pregnant women who are immigrants or incarcerated in a correctional facility, such as jail or prison, may not qualify if they have other health insurance or they have access to employer sponsored health insurance. That brings us to our first poll question. What population does not qualify for BadgerCare Plus? A, pregnant people. B, a child under age 19. C, parents and caretaker relatives living with children under age 19. D, childless adults ages 19 through 64. Or E, people ages 19 to 64 who are receiving Medicare, not including Medicare Part B ID. Again, what population does not qualify for BadgerCare Plus? All right, great job. It looks like most of you did choose the correct answer. The correct answer is E, people who are ages 19 through 64 who are receiving Medicare except for Part B ID are non-financially ineligible for BadgerCare Plus. However, they may be eligible for EBD Medicaid, which we'll be talking about in our session tomorrow. All right, let's talk about the financial rules for BadgerCare Plus. Financial eligibility is based on the household's expected monthly income. In some circumstances, annual income may be considered. Assets are not considered when determining eligibility for BadgerCare Plus. Let's talk about those income limits. The federal poverty level, or FPL, is a federally determined income amount that's scaled based on household size and is usually adjusted every year. The FPL amounts seen here were effective February 1st, 2023, and can be found at the link shown on this slide. The income limit for adults is at or below 100% of the FPL for the appropriate household size. For children and pregnant people, the income limit is at or below 306% of the FPL for the appropriate household size. People whose income is too high to be eligible for BadgerCare Plus may be eligible for advanced premium tax credits, or APTCs, through the marketplace. APTCs can help lower monthly insurance payments when enrolling in a health insurance plan through the marketplace. The American Rescue Plan Act expanded eligibility for APTCs beyond the original 400% FPL limit, and the Inflation Reduction Act extended this provision through 2025. Since this session is specifically about BadgerCare Plus, we won't be going into details about APTCs and health insurance through the marketplace, but we did want to mention those expanded eligibilities for APTCs. Modified adjusted gross income, also known as MAGI rules, are used to determine household size and household income for BadgerCare Plus. MAGI rules are used when determining eligibility for advanced premium tax credits, or APTCs, at the marketplace. Using MAGI rules, IM agencies determine how big the household is, also known as household size, which household member's income is counted, and what types of income and deductions are counted. And that brings us to our second poll question. And I did see a note asking for a little bit longer time on the poll questions. We can absolutely do that. Question 2, the income limit for BadgerCare Plus for pregnant people is what percent of the FPL? A, 100%, B, 150%, C, 200%, D, 256%, or E, 306%. The income limit for BadgerCare Plus for pregnant people is what percent of the FPL? Okay. Great job, everybody. The correct answer is E. The income limit for BadgerCare Plus for pregnant people is 306% of the FPL. All right. Let's move on to how the household size is determined for Magi rules, which can be complex. In some cases, the household size is based on who plans to file taxes and whom they plan to claim as tax dependents. These are called tax rules. In other cases, household size is based only on how the household members are related to each other. These are called relationship rules. As a result of these rules, different household members can have different household sizes. Additionally, for any pregnant people included in a given household, the household size is increased by the number of babies expected. Verification of pregnancy is not required unless the IM agency has information that contradicts the person's statement. So at this point, we're going to walk through some examples. We are going to be using that handout. So I'm going to take a pause here and just see. So it looks like at the top right side of your screen, there's a drop-down menu called Session Information. And if you click on that link, the Session Information link, the link to the PDF should show, it looks like. Is that correct?
I believe so.
Okay, so I'm going to hold off, let you guys check that. Tell me in the live Q&A if you can, if someone was able to find that, just so we know that it's accessible before we.
Maybe share the steps again.
On the top right-hand side of your screen, there should be a drop-down menu called Session Information.
We're getting some positive feedback, so it looks like we're almost
Yay.
there. Okay. It looks good, Nikki.
Yay. Great. Wonderful. I'm going to give you guys some time to either bring that up on a separate screen, or if you want to print it quick and grab it off the printer. We're going to walk through examples. We're going to be using that handout titled Forming a BadgerCare Plus Magi Group. I'm going to give you just a couple minutes to, or maybe a minute or so. Why does a minute seem so long when I'm just sitting here with dead air? When
It's always like that. It looks like a couple of people don't have it, and I'm monitoring them. Try to check your email. I see that others were able to get it through their email. And then if you can, just respond back, letting us know that you received it.
So on our end, there are little circles that say session information, preview, control room, that type of thing. So it might be a little circle with an I in the middle that says session information. Oh, when I click on that, I can find it. BadgerCare Plus worksheet, it's called.
Yeah, that was pretty easy. I didn't know it was on the bottom of the screen for us, at least as presenters.
Right. So you're looking for that session information verbiage.
And while we're working this out, I do see that folks are trying to raise their hand for this, and we're going to go ahead and encourage you to utilize the live Q&A to enter any feedback that you'd like to share, simply because the raise your hand feature and you are all muted during the session. So please utilize the live Q&A and we will attend to your question as soon as we can.
I think they might have been raising their hand to let us know that they were able to access the PDF.
That makes sense, but we were doing it the previous session too, so just a reminder.
Okay, so it looks like possibly on the right-hand side of your screen, I was just provided a screenshot of what it looks like for the member or for the audience member. And on the right-hand side of your screen, it looks like you have drop downs. If you scroll down on the right-hand side of your screen, possibly, that's where you would see the session information. Okay, it looks like you would need to expand the session information section. Can anyone confirm in the chat, in the live Q&A, can anyone confirm they were able to get that off of their session information on there in this presentation? Other than the email? Oh, somebody said they were able to. Yeah, lots of people. It looks like. Thank you guys. I appreciate you responding. So you should be able to get that. By on the right-hand side of your screen, tells you how much time is left in the session, and then it says session information, BadgerCare Plus eligibility rules. If you scroll down and expand that area, you should see the session information link, which you should be able to click and then get the link for. Oh yeah, we've got lots of, I got it. Okay. All right.
Yeah, I think we're good to go, Nikki.
Yep.
The ones that I was monitoring, they got it. So it looks
Sounds
like
great.
Thank
All
you,
right.
everybody.
I just want to make sure, because I think it would be quite confusing for you if you didn't have that to look at. And I don't want to make things any more complicated than they have to be for you. So, or more confusing than they have to be.
Nikki, if we could also just remind folks, last year we wanted a number of individuals to want us to continue to do the walkthroughs, and that will be something that we're offering in that Q&A session that Allison referred to at the end of the conference. So we will definitely offer more time, more review on it at that session. So please don't feel like this is one and done.
All right. In most cases, if an adult in the household is planning to file taxes and is not being claimed as a tax dependent by anyone else, the household includes the tax filer, spouse, and tax dependents. So let's take a look at our first example. Joe and Liz are married and have 2 young sons, Matt and Leo. Liz is pregnant. Joe and Liz plan to file taxes jointly and claim both children as tax dependents. So, using your handout, let's use Joe as the target. So, first we ask ourselves, is Joe planning to file taxes? And he is. So, then we ask ourselves if he'll be claimed by anyone else as a tax dependent. And he won't be. So, the answer to that is no, which brings us to the next block, which is if no, include the target, which is Joe, the target's spouse, which is Liz, and all of the target's tax dependents, which is both children, Matt and Leo. So we're currently at a household size of 4. But then it says if there's a pregnant person in the group, include the number of expected babies and count only one baby if the number of expected babies is unknown. So we know Liz is pregnant, and we're going to assume that she's only pregnant with one baby. So Joe's household size is 5. Joe, Liz, the expected baby, Matt, and Leo. And Liz's household size would also be 5 if we use her as the target. And if we look at one of the children as the target, we get the same result. But let's walk through that. Let's use Matt. Is Matt expecting to file taxes? No, he's a child and he doesn't have a job or any income. So we see that if no, go to step 3. Step 3 asks, is anyone else claiming the target as a tax dependent? And the answer to that is yes, right? Joe and Liz are filing taxes and claiming both children as tax dependents. So if yes, then is the target living in one household with both parents who are not filing taxes jointly? And we just discussed that, right? The answer is no, because the parents are filing taxes jointly. Then, if no, will the target be claimed by a parent living outside this household? And again, the answer to that is no. And if no, then the target's Magi household group will be the same as his or her tax filers group. Matt's tax filer is Joe and Liz, since they're filing jointly and claiming both children. Joe and Liz's household group we said was 5. So Matt's group, as well as Leo's, will be 5, the same as their tax filer. I do just want to mention that the CARES Worker Web System, or CWW, does determine these groups automatically for the IM worker, but it's based on the information communicated in the application, which is why it's so important that those relationships are identified correctly when submitting the application. Moving on to example 2, we have Rich. Rich is a single adult who lives with and provides financial support to his elderly mother, Maggie. He plans to claim Maggie as a tax dependent. We're going to let you practice on this one. I'm going to give you a bit to look at your handout and see if you can identify Rich's household size on your own. And then after we give you time to look at, kind of walk through those steps, I'll give you the answer and we'll walk through it together. But at this time, go ahead and take a couple minutes, walk through that handout, just jot down or keep in your mind what you think the answer will be, and then we'll go through it together. So all right. So let's walk through this one. The correct answer is 2. Rich's household size is 2, Rich and his mother Maggie, since he plans to claim her as a tax dependent. So first we ask ourselves, if Rich is planning to file taxes, and he is, so then we ask if he will be claimed by anyone else as a tax dependent, and he will not be, so the answer is no, which brings us to the next block, which is if no, include the target, which is Rich, the target spouse, and he doesn't have one, and all of the target's tax dependents, which is Maggie, right? So Rich's household is a size of 2, Rich and his mother, Maggie. I do just want to mention that this scenario states Maggie is elderly. So if Maggie was the target in this, um, elderly is defined by Medicaid rules as 65 or older, which would make her non-financially ineligible for BadgerCare Plus. So she may want to apply on her own for EBD Medicaid, and we're going to go into EBD Medicaid tomorrow. But Rich's household size is a household size of 2, and Maggie would not be eligible on his case. Now let's talk about relationship rules. In most cases, if an adult in the household is not planning to file taxes, the household includes the adult, spouse, and their children under age 19 who are living with them. So let's take a look at example 3 together. Mike and Kelly are married and have a young daughter, Fiona. Mike and Kelly do not plan to file taxes. So using your handout, let's use Mike as the target. First, we ask ourselves if Mike is planning to file taxes and he is not. So we see that if no, go to step 3 and ask, is anyone else claiming Mike as a tax dependent? And the answer again is no, nobody else is claiming Mike as a tax dependent. And we see if no, go to step 4, which is to use relationship rules. And relationship rules tells us if they are living in the home, include the target's spouse and his or her children under age 19. It then goes on to talk about if the target themselves is under age 19. We're going to stop there for now because Mike's over 19. So that means that Mike's household size is 3. Mike, his spouse Kelly, and his daughter under age 19, Fiona. And Kelly's household size would be the same, right? But let's look at Fiona's household size. And using our handout, Fiona is the target. She is not expecting to file taxes, so we'll go to step 3. Nobody else is claiming her as a tax dependent. So that takes us to step 4, which again is relationship rules. So we'll count the target spouse and his or her children under age 19. Fiona is a child. She doesn't have a spouse or children. And then moving on, we see that if the target themselves is under age 19, which Fiona is, then we'll include her parents and siblings under age 19 if they're living in the same household. So both of Fiona's parents are in the household and she does not have any siblings. So her household size will also be 3. All right, moving on to example 4. Lars and Laura are childless adults who live together but are not married. Laura is pregnant. Neither is filing taxes. I'm going to give you a bit to look at your handout, and I'm going to have you see if you can identify both Lars and Laura's household sizes. And then I'll give you the answer and we'll walk through it together. So go ahead and take a couple minutes, use Lars as the target first, and then use Laura as the target, and see if you can determine what their household sizes are. I feel like I should play the Jeopardy music. Okay. Let's go ahead and take a look at the answers and walk through them together. Lars's household size is 1. So first, is Lars expecting to file taxes? No. Is anyone claiming him as a tax dependent? No. And he doesn't have a spouse or any children under 19 in the household, so his household size is 1. Laura's household size, though, is 2. So for Laura, first, is Laura expecting to file taxes? No. Is anyone claiming her as a tax dependent? No. Does she have a spouse or any children under 19 in the household? No. But is she pregnant? Yes. So we add her expected baby to her household size, and her household size is 2. Now, relationship rules are also used for children who are claimed as a tax dependent by someone other than their parent, children who are claimed as a tax dependent by a parent who lives outside of the home, and children who live with both parents, but those parents are not filing jointly. When relationship rules are used for children under age 19, their household includes parents who are living with them and siblings under age 19 who are living with them. And we've already seen that when looking at other household members in our prior scenarios. But let's take a look at a few more. Example 5. Jaden, Rylan, and Warren are teenage brothers, all under age 19, who live with their aunt Sarah. Sarah plans to file taxes and claim all 3 brothers as tax dependents this year. So let's walk through this first one together, first with Sarah as the target. Is Sarah expecting to file taxes? Yes. So we know we'll be using tax filing rules. Will Sarah be claimed by anyone else as a tax dependent? No. So we'll include Sarah, her spouse, and she doesn't have one, and all of her tax dependents, which would be all 3 nephews. So Sarah's household size is 4. Now let's use any one of the brothers as the target. Is he expecting to file taxes? No, so we'll go to step 3. Is anyone else claiming him as a tax dependent? Yes. Is the tax filer his parent or spouse? No, it's his aunt, right? So we'll go to step 4, which is relationship rules. And for relationship rules, we'll include, if they're living in the home, his spouse and children. And he's a child, so no spouse or children. And if under the age of 19, which they all are, we will also include his parents, and neither of the parents are in the home, and his siblings under age 19. And he has 2 siblings under age 19 in the home. So each brother will have a household size of 3. All right, for example 6, we have Jocelyn. Jocelyn is divorced and lives with her 17-year-old daughter, Maisie. Jocelyn plans to file taxes, but Maisie's father, Chris, plans to claim Maisie as a tax dependent this year. I'm going to give you a bit to look at your handout and see if you can identify both Jocelyn and Maisie's household sizes, and then we'll go through those together. I'll give you the answers and we'll go through them together. But take a minute, use Jocelyn as the target first, go through the handout, and then use Maisie as the target and see if you can determine each of their household sizes. If I could sing, I would do the Jeopardy music, but it would probably be worse than the blank air. So Okay, let's take a look at those answers then. Using tax rules, Jocelyn's household size is 1, no tax dependence. For Jocelyn, is Jocelyn expecting to file taxes? Yes. Will she be claimed by anyone else as a tax dependent? No. So tax filing rules are used, and we include Jocelyn, her spouse if living in the home and filing jointly, and she doesn't have a spouse, and all of her tax dependents, and she doesn't have any. So her household size is 1. Because Chris is a parent who lives outside of the household and is claiming Maisie, relationship rules are used for Maisie. So Maisie's household size is 2, herself and her mother. For Maisie, is she expecting to file taxes? No. So we go to step 3. Is anyone else claiming her as a tax dependent? Yes. Is the tax filer her parent or spouse? Yes, it's her parent, right? Does she live in the household with both parents who are not filing taxes jointly? No, both parents don't live in the home. And then finally, will she be claimed by a parent living outside this household? Yes. So we go to step 4, which is relationship rules. And again, for relationship rules, we include if they're living in the home, her spouse and children under age 19. She doesn't have a spouse or children. And since she is under age 19, we include her parents and siblings under age 19 if they're living in the same household. So since Jocelyn's mother, since Maisie is living in the home with her mom, her mom Jocelyn is added to her household size, and Maisie's household size is 2. All right, here's our last example. Example 7. Dan and Jackie live together but are not married. They have 10-year-old twins, Sadie and Lily. Dan plans to file taxes and claim both children as tax dependents. Jackie also plans to file taxes. I'm going to give you a bit to look at your handout and see if you can identify Dan's household size, Jackie's household size, and the children's household size. So I'm going to give you a little bit longer for this one. This might take a little bit longer. Walk through your steps using Dan as the target first, and then using Jackie as the target, and then using one of the twins as target. All right, let's go ahead and take a look at those answers. Using tax rules, 3, because he's a tax filer with 2 tax dependents. Is Dan filing taxes? Yes. Is he being claimed by anyone else as a tax dependent? No. So tax filing rules are used, and we include Dan, his spouse, if living in the home, tax dependents, and he's claiming both children. So his household size is. Using tax rules, Jackie's household size is 1 because she's a tax filer. For Jackie, is she filing taxes? Yes. Is she being claimed by anyone else as a tax dependent? No. So tax filing rules are used. And we include Jackie, her spouse if living in the home or filing jointly. all of her tax dependents, and she doesn't have it. For the twins, relationship rules are but not filing jointly. So each child's household size is 4. Sister, and are they filing taxes? No. Are they being claimed by anyone else as a tax dependent? Yes. So we go to step 3. Is anyone else claiming them as a tax dependent? Yes. Is the tax filer the target's parent or spouse? Yes. Do one household with both parents who are not filing taxes jointly? Yes. So we go to step 4, which is relationship rules, and we include, if they are living in the home, their spouse and children under age 19. They're not married and have no children. They're both under age 19 though, so we include their parents and siblings if they're living in the same household. Since they are siblings and both parents live in the household, each child has a household size of 4. And I've got a couple of comments in here saying something about it keeps freezing and then someone else is not hearing anything. I'm not sure why you're not hearing anything. I
Yeah,
assume
if
others are.
Elizabeth and her team can take care of that.
Okay.
I would go ahead and continue.
Okay. All right, to wrap up our conversation about household size, here are just a few additional notes. Tax dependents can be included in someone's household size even if they are living outside of the home or are deceased. Tax filers can claim a deceased child as a tax dependent or a deceased spouse as a tax co-filer in the year they pass, and they would be included in the tax filer's group size. Spouses must always be included unless they're living separately and filing taxes separately. To be considered to be living with a parent, a child under age 19 must be in the parent's home at least 40% of the time. If parents are divorced, only one parent can claim the child as a tax dependent each year. And tax rules are based on how the person plans to file taxes for the current tax year. More information about households can be found in BadgerCare Plus Eligibility Handbook, Chapter 2.3, and the link to that handbook is shown on this slide. The flowchart we provided as a handout today can also be found in the handbook in Chapter 2.3.3. All right, that brings us to our next poll question. Question 3. Relationship rules are not used for the indicated individual in which scenario. And here's a hint. Households may have some people under tax rules and other people under relationship rules, remember. So only think about if tax rules or relationship rules are used for the specified individual described in the scenario. So again, the question is, relationship rules are not used for the indicated individual in which scenario? A, an adult in the household who is planning to file taxes and is not being claimed as a tax dependent. An adult in the household who is not planning to file taxes. A child who is claimed as a tax dependent by a parent who lives outside of the home. Or a child who lives with both parents, but those parents are not filing jointly. Relationship rules are not used for the indicated individual in which of these 4 scenarios. And we're going to go ahead and give you a little extra time on this one. Elizabeth, I'll let you know when you can put up those results. I feel some people are changing their answer based on what I'm seeing. All right, you can go ahead and put those results up. So the correct answer is A, an adult in the household who is planning to file taxes and is not being claimed as a tax dependent. So when an adult in the household is planning to file taxes and is not being claimed as a tax dependent, tax rules will be used to determine household size, not relationship rules. All other individuals described would use relationship rules. All right, next, let's talk about income. First, let's talk about whose income is counted. In general, all household members' income is counted. However, if a household member is a child or tax dependent of another household member, their income is only counted if they're expected to be required to file a tax return for the current year. Now, expected to be required includes children or tax dependents who expect to have more than $13,850 in earned income or more than $1,250 in other income for the tax year. And you may want to jot those facts down for our example. So, again, expected to be required means children who either have more than $13,850 in earned income or more than $1,250 in a year. Now, for this expected to be required rule for children or tax dependents, other income does not include child support, Social Security, supplemental security income, also known as SSI, workers' compensation, veterans benefits, money from another person, or educational aid. So if the child or tax dependent is receiving these types of income, they are not counted when determining if a person meets these thresholds and is expected to be required to file a tax return. Now, these thresholds are updated annually, and the thresholds on this page were effective January 1st, 2023. So let's talk about this in the context of an example. And we're going to go back to example 6 that Jocelyn, she was divorced and living with her 17-year-old daughter, Maisie. Jocelyn plans to file taxes, but Maisie's father, Chris, who doesn't live in the home, plans to claim Maisie as a tax dependent this year. So using tax rules, Jocelyn's household with no dependents. Because Chris is a parent who lives outside of the household and is claiming Maisie, relationship rules are used for Maisie, and Maisie's household size is 2. So you might want to jot that down too. Jocelyn's household size is 1. Maisie's household size is 2. Now, Maisie has a part-time job at McDonald's, and she's earning approximately $400 a month. You might want to jot that down as well. So for Jocelyn's eligibility, which again is tax filing rules, Jocelyn is the only household member, so only her income is counted for her eligibility. And for Maisie's eligibility, her mother's income is counted under relationship rules. Maisie is the child of another household member. Her income is, since Maisie is the child of another household member, her income is only counted in her eligibility determination if she's expected to be required to file taxes. So again, Jocelyn's household size is 1. Only her income is going to be counted. And for Maisie's eligibility, Maisie has a household size of 2. Now remember, Maisie only earns approximately $400 a month, so she expects to earn approximately $4,800 this year from her job and is below the expected to be required to file threshold, which we said was currently $13,850 in earned income per year. So her income is not counted in her eligibility determination. And I want to mention that it's not counted even if she chooses to file taxes. The fact that she's not expected to be required to file supersedes whether or not she chooses to file. Therefore, only Jocelyn's income will be counted for Maisie's eligibility. Now, if Maisie were to earn $1,200 a month from her job or $14,400 a year, she would be above the threshold of $13,850. And then that income would be counted for Maisie's eligibility in addition to Jocelyn's income. But it still wouldn't count for Jocelyn because Jocelyn is a household size of one, just herself. So now that we know whose income is counted, let's move on to what income is counted. Most taxable income is counted for BadgerCare Plus. This includes, but is not limited to, taxable gross earnings from a job, taxable earnings from self-employment, unemployment compensation, student financial aid if used for living expenses, taxable retirement, pension and annuities, and interest and dividends. I want to point out that Social Security income is usually not taxable, but it is counted for BadgerCare Plus unless it's income of a child or tax dependent under that special expected to be required to file rule. Next, let's take a look at what income is not counted. Examples of common types of income that are not counted for BadgerCare Plus include child support, alimony, spousal support, or maintenance payments received under separation or divorce agreements completed after January 1st, 2019, supplemental security income, also known as SSI, gifts or other money from another person, workers' compensation, and veterans benefits. A full list of income that is not counted is available in BadgerCare Plus Eligibility Handbook, Chapter 16.2. So next, let's talk about deductions. A deduction is an amount that can be subtracted from the amount of income used to determine eligibility. Pre-tax paycheck deductions are allowed as BadgerCare Plus income deductions. As an example of this, an example of a pre-tax contribution would be contributions to a health savings account that are taken out pre-tax. Tax deductions listed on IRS Schedule 1, Form 1040 are also allowed, and examples of that include student loan interest paid, higher education expenses, and self-employment tax. Itemized deductions like mortgage interest and charitable contributions are not allowed. A full list of income deductions can be found in BadgerCare Plus Handbook, Chapter 16.3. And that brings us to another poll question. Question 4. What type of income is not counted for BadgerCare Plus? Social Security payments, child support payments, taxable earnings from self-employment, unemployment compensation, or taxable gross earnings from a job. What type of income is not counted for BadgerCare Plus? Okay, great job. The answer is B. Child support payments are not counted as income when determining BadgerCare Plus eligibility. Next, let's talk about some special situations. Special situations include presumptive eligibility, which is also known as express enrollment, gap filling, former foster care youth, income extensions, continuous eligibility for pregnant people, continuous eligibility for newborns, BadgerCare Plus emergency services, BadgerCare Plus prenatal program, family planning only services, and premiums. We're going to go through each of these. Presumptive eligibility, or PE, is also known as express enrollment, or EE, or temporary enrollment, or TE. And honestly, we're not trying to confuse anybody. It's just that sometimes different partners may call a program by a different name. And we want to make sure that you know that whether you hear it called PE, EE, or TE, they're all talking about the same program that provides this express temporary enrollment based on the presumption of eligibility established from household and financial information provided by the applicant to the partner, provider, or qualified hospital. And Maciel mentioned this in our last session. So presumptive eligibility is a streamlined online application for BadgerCare Plus or family planning only services that's facilitated through partners, providers, and or qualified hospitals. And I want to mention that presumptive eligibility, this PE, is not the same thing as presumptive disability, which you may have also heard of. We'll be talking about presumptive disability briefly in the session on EBD Medicaid eligibility rules tomorrow. Presumptive eligibility provides up to 60 days of benefits before the individual must apply for ongoing benefits through the Income Maintenance Agency. And presumptive eligibility is available to children, pregnant people, and adults under age 65. As a note, presumptive eligibility was temporarily extended to elderly, blind, and disabled adults during the COVID-19 public health emergency, but that has since ended. So presumptive eligibility can be granted based on information provided to the provider for up to 60 days. But I just want to note that if the individual applies for and is found ineligible based on the income and information they provide to the IM agency, it can end prior to that 60-day mark. Next, we have information about gap filling. In most cases, eligibility for BadgerCare Plus is based on monthly income. At the marketplace, eligibility for advanced premium tax credits, or APTCs, is based on expected annual income, and only people with household income above 100% of the FPL are eligible for APTCs. So someone can be ineligible for BadgerCare Plus because they have their high monthly income, and then also be ineligible for APTCs because of low annual income. Here's an example. James is unemployed for most of 2023, but starts a job in October earning $3,000 a month. As a single adult, he's well above the monthly income limit of $1,215 for BadgerCare Plus, but his annual income is only $9,000 for the year of 2023, which is below 100% FPL and makes him ineligible for APTCs. In situations like these, individuals can enroll in BadgerCare Plus based on their annual income, and this type of enrollment is called gap filling. Applicants and members found eligible under gap filling rules are certified under a 12-month eligibility period, just like other BadgerCare Plus members. This rolling 12-month certification period can start and end any month of the year. This allows members to keep their certification period even if they change from having their eligibility determined under monthly income rules to annual income rules when they report changes. Because 12-month certification periods often extend over 2 calendar years, the applicant or member's expected annual income will be collected at the beginning of a new year. And by expected annual income, we mean the amount of income the person thinks they will receive in the new calendar year. Now, since people have not actually received this income yet, they may just need to give their best estimate. And verification of the next year's expected annual income is not required since they likely won't have any proof of income they haven't received yet. There are some situations where a person applies at the marketplace and is told their annual income is too low for APTCs. But when their eligibility is determined for BadgerCare Plus, their annual income is too high to be eligible for BadgerCare Plus under gap filling rules. In most cases, it's because they didn't report all of their income when applying at the marketplace. Someone denied BadgerCare Plus under gap filling rules can provide updated income information to the marketplace or appeal their marketplace decision. Moving on to former foster care youth. Former foster care youths include anyone who was in foster care, subsidized guardianship, or court ordered kinship care when they turned 18. For this population, no income limit is applied when determining their BadgerCare Plus eligibility until they turn 26. Keep in mind that their income information may still be needed if they're included in another household member's assistance group, though. Next, let's talk about earned income extensions. When a parent or caretaker relative's earned monthly income goes above 100% of the FPL due to increased earnings, their eligibility and their children's eligibility is extended by 12 months. The parent or caretaker relative must have been enrolled in BadgerCare Plus with a monthly income at or below 100% FPL for at least 3 of the last 6 months prior to that income increase in order to be able to enter an extension. The extension continues as long as the household continues to meet basic non-financial rules and there is no income limit during that extension. However, if the household's verified income goes below 100% of the FPL during the extension, the household will go back to normal BadgerCare Plus. They'll no longer be in that extension period. This is also known as transitional medical assistance. There are other reasons outside of income considerations when someone's eligibility may be extended. And the individuals that fall into these categories are also considered to have continuous eligibility. They include pregnant people who become eligible for BadgerCare Plus. These pregnant women stay eligible through the end of their pregnancy, and they are also eligible during a postpartum period that lasts until the end of the month in which the 60th day after the end of the pregnancy occurs. And babies who are born to a mother enrolled in BadgerCare Plus or Medicaid. So mom must be receiving BadgerCare Plus or Medicaid at the time of the child's birth for this continuous eligibility to apply to the baby. And these babies then stay eligible for BadgerCare Plus until they turn 13 months old. These eligibility periods for pregnant people and newborns continue even if the household's income goes over the program's income limit. Moving on to BadgerCare Plus emergency services. This is a limited benefit BadgerCare Plus program that covers services needed for the treatment of an emergency medical condition when certain individuals meet all BadgerCare Plus program rules except citizenship or qualifying immigration status and having or applying for an SSN. BadgerCare Plus emergency services is not available for childless adults, which remember are those adults ages 19 through 64 who are not living with and caring for a child under age 19. It's not available for children with higher incomes, and it's not available for women enrolled in the BadgerCare Plus prenatal program, which we'll talk about next. While emergency services applications are processed by IM agencies, it is not the responsibility of the IM agency to determine if the applicant's condition is or was an emergency condition and reimbursable under BadgerCare Plus emergency services. It is the IM agency's responsibility to manually determine if the non-qualifying immigrant meets all other eligibility requirements during the dates of service and certify them if they're eligible for emergency services. Medical providers who have treated a non-qualifying immigrant for emergency services may complete the Certification of Emergency for Non-U.S. Citizenship Form F01162 to verify that these services provided were to treat an emergency medical condition, and the patient can provide that to the local IM agency when applying for assistance. The form is not required. Additionally, a provider's certification of emergency by completing that Form F01162 does not guarantee reimbursement. When the medical provider submits claims for that emergency medical services to the fiscal agent determines if a condition is an emergency medical condition covered by emergency services. So while the IM worker does the certification for the individual saying that they are eligible for emergency services during this period of time, they do not determine whether it's going to be covered or not. The fiscal agent, when the claim goes in, decides if that is a coverable service. More information about emergency services can be found at the link shown on this slide. BadgerCare Plus prenatal eligibility is different than regular BadgerCare Plus for pregnant people, which we discussed earlier. BadgerCare Plus prenatal is available to pregnant people who meet all other rules for BadgerCare Plus, but don't qualify because they don't have citizenship or qualifying immigration status, or are incarcerated in a correctional facility such as a jail or prison. People are not eligible for BadgerCare Plus prenatal if they're currently covered by any HIPAA health insurance policy. They may not have current or past access to an employer-sponsored health insurance plan in which the employer pays at least 80% of the premium. People enrolled in BadgerCare Plus prenatal do not qualify for backdated eligibility, and continuous eligibility for pregnant people does not apply to people enrolled in BadgerCare Plus prenatal. Family planning only services are a limited benefit plan for people of childbearing or reproductive age. Family planning only services, also known as FPOS, covers certain services and supplies related to family planning. The income limit for family planning only services is 306% of the FPL. The household size is always 1, and only the individual's own income is counted. Finally, let's talk about children's premiums. Children with household income above 201% of the FPL must pay premiums except for pregnant minors, former foster care youth, children who have met a BadgerCare Plus deductible. They won't have premiums during the remainder of the deductible period. Children in a BadgerCare Plus extension, all children under age 1, including continuously eligible newborns, and American Indian or Alaskan Native tribal members, the son or daughter of a tribal member, the grandson or granddaughter of a tribal member, or anyone otherwise eligible to receive Indian health services. Failure to pay required premiums results in a 3-month period of ineligibility called a restrictive re-enrollment period, or RRP, for the child. But individuals can re-enroll during the RRP by paying the owed premiums. And as a reminder, BadgerCare Plus premiums are currently still suspended due to the COVID-19 temporary rules. And that brings us to our last poll question. Question 5, which of the following is a true statement regarding applicants or members eligible under gap filling rules? A, at the end of the year, members eligible under gap filling rules must reapply for BadgerCare Plus. B, the marketplace must send an application to Wisconsin that has been identified as a possible gap filling situation for gap filling rules to be used in the eligibility determination. C, an applicant or member determined eligible under gap filling rules must submit their expected annual income at the beginning of a new calendar year. Or D, applicants and members found eligible under gap filling rules have a shortened certification period, less than 12 months. Which of those is a true statement regarding applicants or members eligible under gap filling rules. All right, the correct answer is C. An applicant or member determined eligible under gap filling rules must submit their expected annual income at the beginning of a new calendar year, although verification of the next year's income is not required. All right, to finish up, I want to provide you with some additional resources. Online policy resources such as policy manuals, handbooks, forms, and directories can be found by following the first link on this slide, and the specific link for BadgerCare Plus Eligibility Handbook is also shown here as the second link on this slide. Now that does complete the presentation, but we do have some time for questions, and I do see that we do have some questions in the Q&A. First one is, so spouse would mean they are legally married. Yes, that is correct. They would have to be legally married for them to be considered a spouse. Once a child reaches 19, do they have to apply for BadgerCare Plus on their own, even if they have not reached the reassessment period, or do they wait until their coverage ends and then reapply? So children age 19, their eligibility will end the month they turn 19. So if they turn 19 on January 10th, their eligibility will end the end of January, whether it's the end of their renewal period or not. So they would have to reapply on their own for the following month.
However, it's my understanding, Nikki, and correct me if I'm wrong, during this unwinding period.
Yeah, but we're not doing unwinding rules, right? These are regular rules that we're talking about.
Right. And I just want to do a reminder to that, because I think that's where the question's coming from as well, is just that this is regular rules. However, during the unwinding, action needs to take place when the renewal takes place. So, sorry.
Yeah, we don't want, no, that's okay. When you're asking the questions, please do specify if you're talking about during regular times or during unwinding, because we don't want a 19-year-old to lose their eligibility before the household renewal is actually due for someone that's been continuously eligible. So again, we're not going into all of those specific PHE rules in this session, but normal times, a 19-year-old would lose their eligibility at the end of the month they turn 19. All right. Would the children have to be aged out of foster care to apply to this no limit, or could they have been in foster care amount of time, like a year? I believe they have to age out of foster care. I think it actually said, let me go back to former foster care youth. Anyone who was in foster care, subsidized guardianship, or court-ordered kinship care when they turned 18. So that's the rule. It's when they turned 18. Okay, and if they do not qualify, would they have to pay it back? I think this one came up through that at the same time that we were talking about the presumptive eligibility. And the answer to that is no. If they've been determined presumptively eligible through, or it's not, was it presumptive eligibility or was it, sorry, let me go back just 1 minute. Yes, presumptive eligibility or express enrollment or temporary enrollment. If they've been determined presumptively eligible through the provider and then they end up not being eligible, they do not have to pay that back. That's through no faults of the provider or anything. So I don't know what this means. Family is not citizens apply for BadgerCare Plus emergency.
So I think the question is, say for instance, the family presents to a partner or CAC or enrollment assister, and they don't have health care, can they apply for emergency, BadgerCare Plus emergency? And that typically is a question, or is the hospital system assist with? Say for instance, someone presents in the emergency room, they don't have any coverage, and they suffered, a broken arm or went into labor and they didn't have coverage. The hospital typically helps them apply for emergency services.
Thanks, Maciel. Appreciate that. All right, so if a child is getting SSI, this would not be counted. Would it be the same if an adult who is getting SSI? So let's go back to those. What types of income is counted? Social Security income is usually not taxable, but it is counted for BadgerCare Plus. That's regular Social Security, not SSI. What type of income is not counted? SSI. So it doesn't matter if the SSI is the child or the adult. Income that is not counted includes SSI. Whew, we did it. We still have 8 minutes and 8 seconds left if anyone else has any questions.
And if they have any questions after this or
we've got
need
that.
additional details, use that DHS Forward Health Partner inbox.
Yep,
Thank
we'll
you,
go back
Angela.
to that. Whoops, there we go. Yes, any other questions at a later time, you can send to the Forward Health Partner inbox at DHS Forward Health Partners at wisconsin.gov. Anybody have any other questions? All right. Well, thank you all so much for your time and attention today. I hope you all have a great rest of your day. I hope you can kind of get some lunch and take some downtime after all this overload of information you've received this morning. Thank you again.
Well, and thank you, Nikki and Maciel and Elizabeth. And yeah, thanks everybody for attending today. Enjoy the rest of your day, and we'll see you again at 9 o'clock tomorrow for more with DHS and OCI. So thank you.
Thank
Bye.
you.